So this sign is from Toronto. Do your part, stay apart. And you need to be at least 3 geese apart if you're in Toronto, which is good. Now, you are very welcome. It's Monday the 8th of June, and the reason I showed that picture is that it's important to do your part and stay apart. Now, I know everyone knows that, but it's not always practiced, so I just thought I'd put it in anyway. Now, good news. Let's start with good news today. There's lots of bad news, of course, but tragic news, but let's start with some good news. And the good news is about New Zealand. Now, a couple of months ago, I was sort of umming and ahhing whether it would be possible for New Zealand to eradicate the virus from the islands of New Zealand. And I must say at the time I concluded it probably wasn't. And I'm delighted to say they proved me wrong. So let's look at what's happening in New Zealand now. If I get the right screen. There we go. Now, they've had 1,500 cases and 22 deaths. Now, that gives a percentage death rate of 1.46%. Now, I think this is an important figure to look at because the data in New Zealand is pretty complete, and they've had a death rate of 1.4%. Now, we still hope it's going to be lower than that, but that's based on fairly good data. Now, of course, there'll be many cases in New Zealand which weren't diagnosed, and we'll know that more fully when we have the antibody tests. But even for New Zealand has a sophisticated health service, but it's still quite a high number. So that is a bit concerning, but hopefully we'll see that number go down to under 1% when there's more antibody testing. Now, what they call level 1 now, no known active cases of COVID in the country. Just a dream, isn't it? No known active cases. Social distancing no longer required, no more limits on gatherings. Borders will remain closed to non-New Zealanders, of course. Hoping to control any future outbreaks with contact tracing. So they do know that there could be the odd case that pops up, but they're going to test, trace and isolate that, which is excellent. So basically, apart from international travel, New Zealand is back to normal. There's just an unimaginable dream for us in the UK at the moment, and indeed in the United States and many other places, but great news for New Zealand. Now, they do offer ongoing sort of alert advice. So if you're sick, stay at home. If you have cold or flu-like symptoms, get a COVID test. Fair enough. Wash your hands regularly. Sneeze and cough into your elbow. I would prefer tissues. If you're told by health authorities to self-isolate, do it. Of course, you must comply. Work with your GP if you have underlying health issues and are at high risk. Keep a track of where you have been to help contact tracers. So keeping a track of where you have been is a good idea. So keeping a bit of a diary. You could keep that on a phone as well, of course, but keeping a bit of a diary is a good idea. And indeed, the names of people that you're coming into contact with. Businesses should help Kiwis with contact tracing by displaying QR codes. Now, these QR codes are codes issued by the health authorities to particular business premises. And they put them up as a poster, and it means that the contact tracers can put the code in for the business and get a lot of information on it straight away. So it's the posters that businesses put up, so that's a good idea. Be prepared for a move up to a higher alert if needed, and be kind to others. So pretty good advice there. And congratulations to the entire country of New Zealand. It's an amazing thing that you've done. Now, we were talking about disinfectants and bleaches yesterday, and I came across quite a distressing case. And it's only on informal news outlets, but I believe it's true. 3 officers in the Philippines were affected by bleach, and one of the officers died after they were sprayed with bleach, apparently, to disinfect them after dealing with an infected case. So yet another form of victims of this pandemic. And the irony is the officer that died used to be a doctor, was himself a doctor. So great irony and sadness there. for people being sprayed with bleach in Philippines. So just to point out really that this is a real issue. Now I'm doing some work on Africa at the moment. So Cameroon, for example, increasing deaths and increasing cases. But it's actually remarkably hard to get information on what's going on in many African countries. So I'm still kind of working on that, but it looks like infections are increasing. But at the moment, it doesn't look like things are increasing as quickly as we had feared. But it really is hard to tell. In Cameroon, it's illegal to intentionally infect others. It's against the law. So that's good. Maybe we should have that introduced more broadly. Now, Brazil. Only going to publish live data from now on. The government are going to stop publishing the data. But the cases in Brazil and Chile and Peru do seem to be increasing quite dramatically. And as we've looked at in the past few days, there's a lot of fairly upsetting cases, especially in indigenous groups of people from those countries. So and again, not a lot of news available from South America at the moment. The world seems to be a bit distracted, and news of the pain, suffering and death around the world is difficult to get at the moment. Now, the United States, unfortunately, is going to hit 2 million cases in the next couple of days. And deaths are now over 110,000. Important to remember, though, that per capita, the deaths in the United States are still less than, for example, Belgium, and still less than the UK. Now, I just want to show you... let's deal with these protests first. So I did start writing places down: Los Angeles, San Francisco, Chicago, Washington, but then basically the protests are everywhere. And social distancing is usually, often, I don't know, I can't say usually, often not observed. Masks are not always worn. The good thing, of course, is these protests are outside, where the viral load is going to be greatly diluted. But nevertheless, you can't get away from the fact that there are a lot of crowds here going on. Now, these protests have been going on for some time now. So what I did this morning, I went on to Our World in Data, and got up the now this is daily confirmed COVID new cases for the States. So we see that it has peaked up here, and we see that it's just about 22,000 cases per day. But what we notice here is that in the past few days, the number of cases has not been increasing. So far in the United States, I am pleased to say we are not seeing an increase in cases as a result of the demonstrations that's coming through yet. Let's hope this continues to be the case. Having said that, I'm not sure that a lot of people that have been protesting have yet been for testing, and I'll show you something that indicates that may well be the case. So, but what I'm worried about is what we have when this spreads is, first of all, we have individual cases. Now, there will be individual cases in the crowds. This is called the 3 Cs. And then those cases give rise to clusters, and those clusters give rise to further community spread. So that happens first, that happens second, that happens third. And of course, we're at this level already, but this is going to be kind of a vicious circle, kind of reinforcing that, isn't it? Each is going to lead to the other, and you can get a vicious spiral. So in the protests, there will be cases, there's no question about that. Will that give rise to clusters? Will that give rise to community spread? Well, the answer so far is no, it hasn't seemed to feed through into that yet. But of course, we have to wait for the incubation period, the symptomatic period, the complications and the deaths. So things happen in this order. We know they happen in this order. So the bottom line is we don't really know yet. But Andrew Cuomo, governor of New York, has been quoted. I got this from a Telegraph in the UK, I think. Get a test, get a test. People who have been participating in rallies. So people who've been in these rallies should be tested according to Andrew Cuomo. And to facilitate that, the governor is laying on plans to open 15 testing sites dedicated to protesters. So I would ask if you were exposed, and I would tell people you are interacting with, assume I am positive for the virus. So this is Andrew Cuomo. So what we're saying here, what Andrew Cuomo is saying here, and of course I agree with him completely, is that if you've been involved in these protests, if you've been in crowds with people perhaps shouting, perhaps singing, giving out more viruses than normal, I think the safe thing to do is to assume you are infected. And then that would mean you self-quarantine, self-isolate for 14 days until you get a negative test, or you're without symptoms after 14 days. That is the safe thing to do. Which is easy for me to say. I just hope that it's done in practice. But let me just reiterate. The cases at the moment are not going up in the United States. That has the potential to change. So if you could have been infected, and basically anyone in these protests could have been infected, then you need to self-isolate for 14 days and get tested as soon as possible to prevent you being a pre-symptomatic or an asymptomatic spreader and causing other people to get sick and potentially die. Now, Afghanistan, again, very difficult to get news on many places around the world at the moment. These numbers are meaningless because the mayor of Kabul has said there's 1 million people infected in Kabul at the moment. And a reasonable proportion of those are going to die. So we really need to get help to these places that are struggling with purer healthcare infrastructures, because otherwise a lot of people are going to die, and indeed are dying now. Now, Saudi Arabia. Now, in Saudi Arabia, there's a huge amount of foreign workers, Indian, Filipino, Bangladeshi, people from different poorer countries who work there, and they often live in challenging conditions in terms of preventing viral spread, shall we say. So the cases are increasing and the deaths are increasing. That figure's wrong, obviously. No, in fact, 712 is the number of deaths officially recorded in Saudi Arabia. So very low number of official deaths in Saudi Arabia, 712, which is, given that number of confirmed cases, is probably going to be updated soon. But another illustration of the problems of migrant workers living in often confined spaces, as we've seen so many times around the world. Russia is easing the lockdown despite more cases, and again, accurate data from Russia is hard to get. Now, India, record spike in coronavirus cases, of confirmed cases, but of course the testing is very low. Now, I have got anecdotal reports from India saying hospitals in several parts of the country are overflowing at the moment. So we know there's a great increase in cases in India. And I mean, the epicenters were New Delhi, Mumbai, Ahmedabad, but other places as well. And what struck me, Delhi has reserved hospital beds for residents. Now, I don't know. Again, the news is hard to get at the moment. It really is. There's so many people suffering so much around the world, and it's really hard to get news on them. So what I've heard is that hospitals in Delhi are reserving places for residents. Now, I don't know if that's all hospitals in Delhi or just some hospitals in Delhi. So if you're an Indian nurse or doctor, do let me know what's going on, please. But this would give rise to the spectre of people coming in for hospital care who were sick and were turned away because they weren't residents. So it's a pretty nightmarish scenario. And apparently many sick people are flocking into the city from the provinces to try and get treated. But it looks like some hospitals, or many hospitals, I don't know, all hospitals, I don't know, are being reserved for residents. So we clearly have the spectre there of sick people potentially not getting the treatment that they need to get, and no one seems to be talking about this at the moment, as many people are going to die, are dying at the moment. There is urgency here, please. There is urgency. The UK. New cases, according to my COVID tracker app, 9,400 across the UK as a whole. That's the 4 countries of the United Kingdom. Now, the Office for National Statistics puts it lower than that, but that's my COVID tracker app. So the real number is perhaps not a lot less than that, actually. I think the COVID tracker app's pretty accurate, actually. Deaths are increasing much more slowly. I think this is probably the lowest deaths for some time. But of course, the overall number keeps on ticking up the way. That doesn't change. As of today, arrivals to the country after self-quarantine for 14 days. Now, tourist areas, most of the toilets are closed. And this sounds like a bit of a funny point, but it's not, because obviously people are availing themselves of alternative toileting facilities. So not a good situation, really. And lots of tourists going to touristy areas like Devon. And the facilities are closed, so it's not a hygienic situation. Now, I learned something the other day, and I didn't know this before. The Scientific Advisory Group for Emergencies in my country, SAGE, apparently it's got 100 members. It's the first I knew about it. I just heard it on the news the other day. Apparently there's 100 members, so that's good to know. So there you go. We're being advised by 100 scientists. Still a bit of a shadowy organisation, though. It would be great to have much more. I mean, really, I don't know, I've just missed it, but the names, the academic qualifications, the curriculum vitae, the medical and associated educational research institutions should all be in the public domain, as far as I can see. Why there is this lack of transparency? Maybe I just haven't done enough research. Maybe it is, but it's not obvious who is on SAGE, why they're on SAGE, and what's their qualification for being on SAGE. Oxford and AstraZeneca vaccine. Now, this is the big excitement in the UK. So the Oxford-AstraZeneca collaboration, they can make 2 billion doses of vaccine really quite quickly. And they're going to announce in August whether it works or not. So let's find out, hopefully, that it works and is effective at that time. Now, central London crowds, 27 officers injured as of a couple of days ago, actually. And Ken March, who is the representative of the Police Federation, said that the protesters should not be there and the protest should not be allowed. And yet they carry on. The level of spread from this, as in the United States, we don't know what it's going to be yet, but I suspect it's not going to be good. Now, disparities in the risk and outcomes for COVID-19 has been talked about for some time, of course. And I read the government report yesterday on this, which you can access. You can access that here. Now, it's a remarkably mundane read and says hardly anything that we didn't know. Over 80s, 70 times more likely to die than under 40s. Okay, that's a statistic. We pretty well knew that the older people are more at risk. More males than females, well, I think we knew that. More black, Asian and minority ethnic groups are getting severe disease and dying. I think we know that. These analyses take into account age, sex, deprivation, region and ethnicity. So in other words, what they're saying is that more black, Asian and minority ethnic people are dying. And it's not due to differences in age. It's not due to differences in sex. It's not due to differences in social deprivation. It's not due to differences in where they live. I don't know what they mean by ethnicity. Anyway, they're saying it's not due to ethnicity. but they do not take into account the existence of comorbidities. So more people in Black, Asian and minority ethnic groups are getting sick and more are dying, but it's not due to these social factors. And in the entire report, they manage not to mention the two main factors that probably are affecting this, which is deficiency of vitamin D and air pollution. Vitamin D is a vital immunological molecule. Air pollution is almost certainly a risk factor. The report managed to completely ignore that. What a disappointing report. Now, Netherlands. Oh, this is awful. 4 million mink probably have to be killed in Netherlands. Now, I didn't know this. Netherlands is big on mink farming. Now, there is just no need for animal furs. We can make synthetic fibres these days, and yet they're keeping 4 million of these animals in Netherlands, and now they're having to kill them, or certainly killing most of them. I don't know if they're going to kill all 4 million. Because infections have been confirmed in mink. Now, what happened here was there was a family that farms mink in the Netherlands, and they became infected with COVID-19, but they established that they didn't catch it from other people. And as far as I understand, I haven't got the full story, it's not published, but as far as I understand, they did an analysis of it, presumably what we call a phylogenetic analysis, and they worked out that they caught the infection from mink by looking at the genetics of that particular viral strain. So they're worried now about the mink being a reservoir for the disease, and they're killing probably 4 million of them. Very upsetting story. Denmark and Spain apparently also have mink farms, which I didn't know. Now, let's close with some much better animal news. Detection dogs can help in the detection of COVID-19. Can the dog alert on COVID-19 positive person by sniffing auxiliary sweat samples? So we have talked about this before. Now, dogs are just the most amazing creatures. Have the most amazing olfactory systems. They can smell all sorts of stuff. And what they did was here they collected sweat samples from armpits, and the dogs were able to tell whether the people were infected with COVID-19 or not. Now, this could just be a remarkable diagnostic device. Now, you get dogs that you don't see a lot of studies on it, but apparently dogs have sniffed breast cancer, for example. And you get dogs that know when their owners are going to have epileptic fits, and they start barking, so they lie down and put their mouth airway in. Just remarkable, as well as blind dogs as well, of course. So truly amazing creatures. Now, this is a preprint study, so I can't report on it with any degree of certainty. But here we have some provisional data. Well, it's not provisional data, it's data from this study. So these are the dogs. So Gun, for example, was 90% successful. Oslo was 94% successful. Mayika, we might put her on other duty, she was only 83% successful. But HK, Axo, Bella and Jackie, they were tried these number of times. I mean, Jackie, for example, was tried 68 times with a 100% success rate. I mean, that is simply phenomenal, Jackie. And Bella, and Asco, and HK. I mean, just amazing. We have dogs that can detect with 100% accuracy here whether the sweat in someone's armpits is indicating whether they have COVID-19 or not. We really should be doing more research on this because that's just the most potential. The potential for, if you had dogs and the dogs walk around and they just sniff and bark every time someone's got the virus, and those people are then isolate for 14 days, we could probably stop this pandemic in its tracks in a few weeks if we had enough dogs doing that. let's let's work on this one. It's just amazing. And as this paper says, it's not definitive research, but it's proof of concept, evidence of concept. So we conclude that there is a very high evidence that armpit sweat odour of COVID-19 persons is different, and that dogs can detect it. I really think we should go flat out into that. I mean, the potential for poor areas in the world, for example, like India, where there's limited amounts of testing, is just immense. Places where there's testing infrastructure with sophisticated chemical tests. All we could do here is just have dogs sniffing it out for us. Australia. Since June the 1st easing of restrictions in Australia, it seems we've all gone a little bit nuts. I live in a popular tourist area, work in a hotel, middle of a holiday weekend. I've witnessed semi-intoxicated strangers hugging each other. That sounds remarkably pleasant, but it's still a risk. And in general, we seem to be totally ignoring our government 1.5 metre social distancing guidelines, let alone 2 metres, which seems to be the logical recommendation, as I've said so many times. We are not sanitising surfaces, glass table surfaces, effectively between different groups of guests being seated. Guests have sat down at glass top tables that have not even been cleaned. And no one seems to care. Sanitising measures seem cursory at best. A lot of this is to do with the fact that this hotel has reopened very rapidly, and we have been very much overwhelmed by an influx of guests this weekend. We reopened on Friday after 2 months of closure to full hotel occupancy on Saturday night. I assume this situation in this hotel where I work is not unique. So, if you're in Australia, remember, the virus has not gone. You are not in New Zealand, you are in Australia, and you've got a bit of work to do yet. Now let's look at some excellent pictures. This is David, who watches in Hong Kong. So good to know that you're watching in Hong Kong, David. And of course, being Hong Kong, masks are obligatory. This is Ayad, who watches in Algeria. Great to know you're watching, Ayad, in North Africa. Thank you for watching there. This is Jack and Velita, who live in the Baltic state of Estonia. Never been there. I've always fancied going, but never got round to it. So thank you, Jack and Velita from Estonia. This is James from Melbourne in sunny Australia. This is James from Wisconsin. Good to know you're watching in Wisconsin, James. I wonder if James drinks Guinness. Good to know you're watching. Oh, this is Jan, who makes masks. And here we see Jan herself. Excellent, making very attractive looking homemade masks. Thank you, Jan. This is Jan also, but in the Netherlands. So good to know that Jan is watching in the Netherlands. Thank you for watching. Thank you for the picture. This is Janet in, I'm guessing, but it could be Brisbane, Australia. Janet, wonderful picture. Thank you for the compliment. So kind of you. In fact, we'll just have a bit of a zoom in on Janet since she's been so nice to me. Great to know you're watching. Hello everyone. Thank you, Janet. Great picture. This is John, who watches in Scotland. Clearly well protected. Well practiced for going out into public spaces. Juan watches in Texas. Great to know you're watching down south there. Joanne in Texas. This is Julia, who's in Vancouver. And I think this might be Rio. Also, perhaps not taking such an interest. But great to know you're watching in Canada. Thank you, Julia. And this is Muhammad, watching in Pakistan. So good to know that you're watching out there in the subcontinent, Muhammad. Thank you for the picture.